For the last year, Colorado children have been denied dental care that could save their teeth.
Denver 7 consumer investigator Jacqueline Allen is digging deeper into why this is happening and how one simple code change altered everything.
The 10:30 or the 11 o'clock work?
At Bobak Orthodontics in Lakewood.
Thank you.
From the inside, you can get a better view.
Dr. Wojtek Bobak has been helping kids smile for nearly 3 decades, but this year, something changed.
The bottom line is for the last 11 months, I have not been able to treat kids that desperately need orthodontic treatment to prevent severe permanent damage to their front teeth.
This isn't just for kids who want straighter teeth.
Correct. It's called medically necessary orthodontics.
What happens if these kids don't get this treatment?
They could potentially lose teeth.
The problem started after the American Association of Orthodontists announced a code change in their manual. Have you had children who were denied because of this?
Absolutely, yeah. We've had multiple kids denied. They're the kids that need it the most. And there's just certain things we have to do at age 8, 9, and 10 in certain cases. And if we miss that window, we miss the chance to fix someone's bite and change their life and prevent problems that can't be fixed later.
Dr. Michael McEwen, a Glenwood Springs orthodontist, says this new code was supposed to eliminate redundancy. But in Colorado, instead of switching to the new code, he says the state Medicaid provider simply stopped covering these children's procedures, denying critical coverage to low-income families.
We just couldn't get this girl to smile.
Including dozens of Dr. Bobak's patients like this little girl. Her front teeth are growing into each other, and without treatment, will have to be pulled.
It's a simple treatment. I've done it thousands of times, and now I can't do it.
This little girl can't get the treatment.
This little girl cannot get a treatment, although technically she should.
Other states, such as Montana, simply deleted the old codes, changed to the new ones, and kept covering kids.
It's a half a page letter that was extremely simple to do.
Is this really as simple as a code change?
I think luckily it is. It's just something that got lost in the mix.
But after 11 months of finger pointing and meetings, Colorado orthodontists say they can't cut through the red tape. So they're asking for help, not for themselves, but for Colorado children. Why did you reach out to contact Denver 7?
Well, because I'm at a loss. I have no idea who else to talk to. I think it's just a bureaucratic quagmire, blame being shifted around, and the end result is the kids that suffer.
We reached out to the state's Department of Healthcare Policy and Financing, the Medicaid administrator. A spokesman tells me these services should be covered, stating, quote, "We are actively working with our providers and DentaQuest to resolve any confusion stemming from the national change in billing codes." Meanwhile, he says orthodontists can submit requests with any nationally approved code. Now, again, we spoke to several doctors who say that is just not true. We are shining a light on this problem now, and we'll keep you posted on when the state clears up the confusion for Colorado's children. For Contact Denver 7, I'm Jacqueline Allen.
And we want to be clear, this is not about straightening teeth. These are severe dental issues that are not being covered. Contact Denver 7's involvement in this issue seems to be making an impact. Dr. Bobak got back to us saying the state's Medicaid administration scheduled a Zoom meeting with him after 11 months of trying to get someone to listen. And Dr. Bobak is now confident the ball is finally rolling. We'll keep you posted.